Hello, my name is Marian. In today's video, I have 75 practice test questions and answers for you to help you prepare for your CT registry exam. Don't forget to comment your score at the end of this video, like how many questions you missed, or you can say my score is for this test, or how many questions you got wrong. And then also watch the whole video and make sure that you stay to the end because I will link my playlist on the screen for you to check out my other question videos that I have and lesson review videos that I have. So I do have this disclaimer here. I will let you all pause it and read it because I always get someone who asks me a question in the comment box that asks me if these questions are exactly what's going to be on the CT registry exam. So the answer to that question is right in here. So I will let you all pause it and just read it. All right, so the quick tips that I have for you to make your studying more successful, pretty much, you have to watch the entire video for this to help you. Read the entire question and the answer choices. If you skip around, I'm pretty sure you're going to miss something important. Also, if you see a question or a topic that I have not covered in this video, it's probably because I have already made the video because I have over 40 videos, I believe, for the CT registry exam. So any physics or patient care or anatomy question that you do not see in this video, probably have it in my other video. That's why I said to click on my playlist at the end of this video, or you can always find it in the description box under my title on my video whenever you're on YouTube. If I'm going too fast, you can always pause the video, write down whatever question you stopped on if the video is too long for you. But that's the best way you can be successful from this video because some people think they can just skip around. You're not going to know anything if you're just skipping around. All right, so if you're new to my channel, I like to read the question. The answer choices give you like a few seconds to think about the answers. Please pause the video if I'm going too fast, if you need to read the questions or rewind it so that you can understand why the answer is the answer. Also, if my audio, like if I'm speaking out the questions, if it bothers you, you can always mute the video. If anything on the screen, me, anything else that I have on the screen is bothering you, you can always cover it up with the sticky note. This is just how I like to do my videos, so I just like to throw that out there. If anything is bothering you, there are ways to hopefully fix it. All right, so here we go. Before you forget, please like the video and hit the subscribe button so that I can keep making videos and content like this. It helps to support my channel and it does go a long way. So thank you. And question one, the ability of a system to define small objects is called A, contrast resolution, B, matrix, C, spatial resolution, D, voxel. All right, the correct answer is C, spatial resolution. Question two, the benefit of temporal resolution for CT scanners is to A, decrease artifacts, B, decrease the slice thickness, C, increase KVP, D, increase mass. All right, the correct answer is A, decrease artifacts. So temporal resolution is how fast the CT scanner can take images quickly. So the quicker the scanner can take the images, the less artifacts and motion will occur on the images. Question three, which kind of exams are temporal resolution ideal for? A, abdomen scans, B, biopsy procedures, C, cardiac scans, or D, extremity scans. All right, the correct answer is C, cardiac scans. So temporal resolution is great for cardiac imaging because it can reduce motion artifacts from the patient's breathing. Remember the last question? I discussed that it helps the machine pretty much go faster so that it can reduce any motion. Question 4. The thickness of the slice or plane is called the A, x-axis, B, y-axis, C, z-axis, D, none of the above. All right, the correct answer is C, z-axis. Question 5. How fast the CT scanner can acquire an image is called A, contrast resolution, B, pixel, C, spatial resolution, D, temporal resolution. All right, the correct answer is D, temporal resolution. So if you always paying attention in the last two questions, I believe, then by now you should know temporal resolution. So it's important to know your definition for contrast resolution, pixel, spatial resolution, temporal resolution, matrix, voxel, all of that is important. So I do have these, like I said, terms in other videos. Also make sure that you're finding it in your book and writing down those notes and make sure that you remember it as well. Question 6, fill in the blank. A two-dimensional square that is in the matrix is called a. So I'll give you a few seconds to think about the answer. So I'm not going to give multiple choice for this one. All right, the correct answer is pixel. So I'm not saying that your registry exam because everyone is watching my video. Even though I titled the video for ARRT registry exam, everyone is watching it. National people is watching it from different countries, different states. So I'm not saying that your question will have a fill in the blank answer. This is just a different way that you can learn the information. That's why I said knowing the definition for pixel, matrix, all of that is important. So I'm trying to find other ways for you to know it. So a two-dimensional square that is in the matrix is called a pixel. So keep that in mind. Question 7. A picture element is also referred to as a or an A, contrast resolution, B, matrix, C, pixel, D, voxel. All right, the correct answer is C, pixel. And the easiest way that I remember this for some reason is it say picture element and pixel has a P, picture has a P. So I don't know. You just have to find your little thing to help you figure out the answer easier if it's just hard for you to grasp the concept. Question 8, fill in the blank. A volume element is known as a blank. So what is the answer? All right. So the answer is a voxel. So kind of like same thing with this one. It's important to know what a voxel is. So easiest way I remember this is volume has a V in it, voxel has a V in it. It also has an E in it. Voxel has an E in it. So I don't know. That's just how I remembered it the best. Question 9. Which anatomy structure is the arrow pointing to? So this is one that you just have to guess. All right, the correct answer is the spleen. Are you all great with your anatomy? Can you put it down in the comment box for me? At one point, I was trying to add a lot of anatomy, but people kept telling me that they feel like they was weaker in physics, so they wanted more physics questions. So I may just start back just adding anatomy because I was adding a lot of physics questions. Then I started getting later comments saying, but I'm weaker in anatomy too. So let me know down in the comment box, 'cause it would help me know if I should make more anatomy videos, if I should add more anatomy images. Question 10. Which anatomy structure is the arrow pointing to? A. Inferior rectus muscle. B. Lateral rectus muscle. C. Superior oblique muscle. D. Superior rectus muscle. All right, the correct answer is B. Lateral rectus muscle. Question 11. Which sinus is the arrow pointing to? A. Ethmoid sinus. B. Frontal sinus. C. Maxillary sinus. D. Sphenoid sinus. All right, the correct answer is C. Maxillary sinus. Question 12. Which anatomy structure is the arrow pointing to? A. Crista galli. B. Mandible. C. Orbital plate. D. Zygoma. All right, the correct answer is A. Crista galli. Question 13. A grid that is created by rows and columns of pixels are called A. Contrast resolution. B. Gantry. C. Matrix. D. Voxel. All right, the correct answer is C. Matrix. Question 14. Which of the following would be considered a positive contrast agent? A. Air. B. Iodine. C. Water. D. CT does not use positive contrast agents. All right, the correct answer is B. Iodine. So air and water is considered a negative contrast agent. And if you've been working in X-ray for a long time, you probably was able to figure out this answer easily. Question 15. What is it called when an X-ray beam is reduced or minimized by an object? A. Attenuation. B. Density. C. Filtration. D. Pixel. All right, the correct answer is A. Attenuation. And if you all need explanations, they're in my lesson review videos that I have that you can find in my playlist. Question 16. A low density structure on the CT image would be A. Bone. B. Calcification. C. Hemorrhage. D. Lungs. All right, the correct answer is D. Lungs. So the low density structure is something like you'll see it as black on the CT image because the attenuation is very little. Question 17. Which of the following would appear as white on the CT image? A. Kidney cyst. B. Lungs. C. Surgical clips. Or D. Trachea. All right, the correct answer is C, surgical clips. So surgical clips will appear as white on the CT images because of its high density or high attenuation. Question 18. Hounsfield units are named after A. Nikola Tesla, B. Raymond Damadian, C. Sir Godfrey, D. William Conrad Rinkin. All right, the correct answer is C. Sir Godfrey. So he invented the CT scanner, and the Hounsfield units are named after him or were named after him. Question 19. The measurements in CT is shown in A. Hounsfield units, B. Kilovoltage peak, C. The matrix, D. The voxel. All right, the correct answer is A. Hounsfield units. And later on in the video, I have like different Hounsfield units questions that I ask you for different organs. All right, so if you are finding this video helpful and want me to make more, could you please like the video, also share and subscribe to my channel? I greatly appreciate it, so thank you all so much. Question 20. The number 0 will be the Hounsfield unit for A, blood, B, fat, C, muscle, D, water. All right, the correct answer is D, water. Question 21. Negative 1000 will be the Hounsfield unit for A, air, B, bone, C, muscle, D, water. All right, the correct answer is A, air. Question 21. The Hounsfield unit for fat will be approximately A, negative 100, B, negative 1000, C, 400, D, 600. All right, the correct answer is A, negative 100. Question 22. The purpose of filtration is to A, reduce low energy photons, B, reduce high energy photons, C, increase the mass, D, increase the low energy photons. All right, the correct answer is A, reduce low energy photons. So low energy photons increases patient radiation dose. So filtering these photons will reduce the radiation dose for patients. Question 23. The window width controls the A, brightness of the image, B, contrast of the image, C, how to move the image, D, thickness of the image. All right, the correct answer is B, contrast of the image. So that question always confuses people. So I suggest you all like rewind it to question 23 and just read the question again and answer it because that always get people confused. Question 24. The window level controls the A, brightness of the image, B, contrast of the image, C, how to move the image, D, thickness of the image. All right, the correct answer is A, brightness of the image. So whenever you're talking about window level and window width, the answer is either going to be brightness or contrast. And the easiest way for me to remember window level, controlling, or brightness of the image is window level. It was so hard, but like I was telling you, you have to pick out things in the answer for it to be the answer to help you remember it. So level has two E's in it. Brightness has an E in it. I don't know why, but it was so easy for me to remember window level goes to brightness when I correlate those two. But anyway, the window level controls the brightness slash the density. Question 25. The Hounsfield unit for gray matter of the brain is approximately A 20, B 40, C 600, D 800. All right, the correct answer is B 40. Question 26. Beam hardening artifacts are more prominent in which area of the body? A. Ascending aorta, B. Descending aorta, C. Base of the skull, D. Pulmonary vein. All right, the correct answer is C. Base of the skull. So the beam hardening artifacts are caused when the X-ray beam is trying to penetrate through a dense structure like the petrous bones or the base of the skull area. Question 27. Which artifact is shown in the image below? A. Beam hardening artifact, B. Motion artifact, C. Ring artifact, D. Partial volume averaging artifact. All right, the correct answer is A. Beam hardening artifact. So beam hardening artifacts can be reduced by increasing the KVP, using a thicker filtration, and by positioning the patient in a way that the dense objects are away and out of the beam. And those are just to name a few. Question 28. Which of the following results in higher radiation dose to the patient? A. Increasing display field of view. B. Low mass. C. Thicker scan slices. D. Thinner scan slices. All right, the correct answer is D. Thinner scan slices. So whenever you pass your registry or if you're using this for your CQR assessment that you have to take every 10 years, um, then you know or you will know that the radiologists sometimes they call and they request thinner slices. So majority of the time when the doctor call back and want thinner slices, you don't bring the patient back to scan them and make the slices thinner. You retro recon it to make it thinner slices, because thinner slices can increase patient radiation dose. That's why most of the scans, especially like for abdomen scans, it's going to be thicker scan slices like at 5. So if someone is asking for like 1.5 or 1.25 slices, that's like very thin. So that's why we just retro recon it. Also, increasing the display field of view, it doesn't do anything but increase whatever coverage you're trying to see. It doesn't increase the patient radiation dose. Low mass is the best because it lowers the dose to patient. When you start increasing your mass, it gives more dose to the patient. And like I said, most scans are done with thicker scan slices, especially for abdomens. Question 29, another fill in the blank. When tissues of different attenuation numbers are averaged to create a pixel that is less accurate, this is called. All right, the correct answer is partial volume averaging. So you can pause it and just reread the question and the answer. but this is the correct answer. So make sure you know your definitions. Go back to the back of whatever textbook you're using and make sure that you know all the definitions. Question 30. Which axis is considered the slice thickness? A, U axis, B, X axis, C, Y axis, D, Z axis. All right, the correct answer is D, Z axis. So there's no U axis, but I just threw that in as one of the answer choices. So just make sure you know what the X, Y, and Z axis is for. Question 31. Which of the following is the ability to distinguish one soft tissue from another with similar densities as their background? A, contrast resolution, B, noise, C, spatial resolution, D, temporal resolution. All right, the correct answer is A, contrast resolution. So hopefully by now in this video, you know or will know the difference between contrast resolution, spatial resolution, temporal resolution. Question 33. How long should you at least scrub your hands for during hand washing? A, 5 seconds, B, 10 seconds, C, 15 seconds, D, 20 seconds. All right, the correct answer is D, 20 seconds. So that's one confusing question. That's why I put this from the CDC website because, like I'm saying, medical is always changing. People is always researching things. So numbers changes all the time. So it say on their website, and this is in 2026 of January, scrub your hands for at least 20 seconds. So as you can see, that's on their website, and I highlighted it up here. Let's see, at the top. All right. Question 34. Which of the following is a major disadvantage of the CT power injector? A, allergic reaction, B, extravasation, C, longer injection rate, D, shorter injection rate. All right, the correct answer is B, extravasation, meaning the IV can kind of like puff up, the IV site can puff up, and instead of the contrast getting into the actual vein, it's going into the surrounding tissue. And that can happen depending on if the IV site was a bad IV, or if the patient didn't have their arm straight out, or if um, if the injection right, it could be many different things. Question 35. Which term is used to describe the qualitative measure of the X-ray beam? A, kilovoltage peak or kVp. B, matrix. C, milliamperage second or your mass. And D, pitch. All right, the correct answer is A, kilovoltage or kVp. Question 36. Which term describe voxels with equal dimensions along the X, Y, and Z axis? A, anisotropic, B, isotropic, C, matrix, D, pixel. All right, the correct answer is B, isotropic. Question 37. Which type of scanning rotates in a continuous motion around the patient while the table moves through the CT scanner? A, axial scanning, B, cine scanning, C, helical scanning, D, multi-slice scanning. All right, the correct answer is C, helical scanning. Question 38. Which imaging plane divides the body into equal left and right sections? A, axial plane, B, coronal plane, C, sagittal plane, D, transverse plane. All right, the correct answer is C, sagittal plane. Question 39. Which imaging plane divides the body into upper and lower sections? A, axial plane, B, coronal plane, C, oblique plane, D, sagittal plane. All right, the correct answer is A, axial plane. Question 40. Which imaging plane divides the body into anterior and posterior sections? A, axial plane, B, coronal plane, C, oblique plane, D, sagittal plane. All right, the correct answer is B, coronal plane. Question 41. A perfusion scan is ordered on a patient. Which condition is the doctor trying to rule out for this patient? A, deep vein thrombosis, also known as DVT, B, pulmonary embolism, which is also your PE, C, seizures, D, stroke. All right, the correct answer is D, stroke. So I worked at a hospital and both outpatient imaging clinic as a CT tech, and I've never seen um, a perfusion ordered on an outpatient, like for at an outpatient imaging clinic for a CT scan, because that's not a routine scan that you do. It's something that you like do if you suspect that a patient could be having a stroke, because it does give like a high radiation. You can see the brain and the vessels and the arteries great with that. So perfusion is not something that you're gonna be working at an outpatient imaging clinic and someone just comes in with that order. It's something that's gonna be ordered like from an ER department. Question 42. Which anatomy structure is the arrow pointing to? A, ethmoid bone, B, sphenoid bone, C, temporal bone, D, zygoma bone. All right, the correct answer is D, zygoma bone. Question 43. Which anatomy structure is the arrow pointing to? A, fourth ventricle, B, lateral ventricle, C, septum pellucidum, D, third ventricle. All right, the correct answer is B, lateral ventricle. Question 44. Which anatomy structure is the arrow pointing to? A, aorta, B, celiac artery, C, inferior vena cava, D, inferior mesenteric artery. All right, the correct answer is A, aorta. Question 45. Which anatomy structure is the arrow pointing to? A, aorta, B, celiac artery, C, inferior vena cava, D, inferior mesenteric artery. All right, the correct answer is C, inferior vena cava. Question 46. Which anatomy structure is the arrow pointing to? A. Celiac artery. B. Right common carotid artery. C. Right common iliac artery. D. Right renal artery. All right, the correct answer is C. Right common iliac artery. Question 47. Which anatomy structure is the arrow pointing to? A. Left atrium. B. Right atrium. C. Right ventricle. D. Superior vena cava. All right, the correct answer is B. Right atrium. Question 48. The forward slipping of an upper vertebral body over the lower vertebral body is called A. Sciatica. B. Spinal stenosis. C. Spondylolisthesis. D. Spondylosis. All right, the correct answer is C. Spondylolisthesis. Question 49. What is the second leading cause of cancer death in the United States? A. Breast cancer. B. Colorectal cancer. C. Lung cancer. D. Prostate cancer. All right, the correct answer is B. Colorectal cancer. Question 50. What is the most common site for primary cancers to metastasize to? A. Kidneys. B. Lungs. C. Pancreas. D. Stomach. All right, the correct answer is B. Lungs. All right, so if you all need to just take a break, go grab you something to eat, something to drink, you can do so. Make sure that you come back to the video so that you can finish it because I do have a lot more challenging questions that you need to know towards the end. So grab your snack and then just come back to the video. All right, so after you have had your snack or if you're snacking now, question 51. A patient is complaining of pain in the left lower quadrant. Which condition best describes this patient's symptoms? A. Appendicitis. B. Diverticulitis. C. Gallstones. D. Kidney stones. All right, the correct answer is B. Diverticulitis. So if the patient was having pain in the right lower quadrant, that would be the appendix. Also know that the gallbladder is found in the right upper quadrant. Question 52. A patient is complaining of pain in the right lower quadrant. Which condition best describes this patient's symptoms? A. Appendicitis. B. Diverticulitis. C. Gallstones. D. Kidney stones. All right, the correct answer is A. Appendicitis. Keep in mind the appendix is found in the right lower quadrant. And then we said the diverticulitis is found in the left lower quadrant. Question 53. A patient is complaining of pain in the left upper quadrant. Which organ will these symptoms affect? A. Appendix. B. Liver. C. Sigmoid colon. D. Spleen. All right, the correct answer is D. Spleen. Question 54. Which window setting is the best for visualizing the long parenchyma? A. Window width 350, window level 40. B, window width 600, window level 50. C, window width 1500, window level -600. D, window width 2000, window level 400. All right, the correct answer is C, window width 1500, window level -600. Question 55. Which window setting is the best for visualizing the brain? A, window width 80, window level 40. B, window width 150, window level 60. C, window width 350, window level 40. D, window width 350, window level 60. All right, the correct answer is A, window width 80, window level 40. Question 56. Which of the following does window level control? A, brightness, B, contrast, C, pixels, D, slices. All right, the correct answer is A, brightness. So put it down in the comment box for me if you got that answer right. So for question 56, put it in the comment box, I got question 56 right, or put I got question 56 wrong. Because at the beginning of the video, remember I asked you a question similar to this, and I told you how important it was to remember it. So just let me know down in the comment box. Question 57. Which window setting is best for visualizing bone? A, window width 350, window level 40. B, window width 600, window level 50. C, window width 1500, window level -600. D, window width 2000, window level 400. All right, the correct answer is D, window width 2000, window level 400. Question 58. We're almost done. Which of the following does window width control? A, brightness, B, contrast, C, pixels, D, slices. All right, the correct answer is B, contrast. So same with this question. If you all paid attention and seen it at the beginning of the video, it did skip around. Put it in the comment box. I got question 58 right. Or put I got question 58 wrong. Question 59. The window setting, window width 150 and window level 60 is best for visualizing which of the following? A, bone, B, brain, C, liver, D, soft tissue, abdomen. All right, the correct answer is C, liver. Question 60. The window setting, window width 600 and window level 200 is best for visualizing which of the following? A, brain, B, CTA vessels, C, liver, D, soft tissue abdomen. All right, the correct answer is B, CTA vessels. Question 61. So 14 more questions to go. The window setting, window width 130 and window level 60 is best for visualizing which of the following? A, brain, B, CTA vessels, C, soft tissue abdomen, D, subdural or stroke. All right, the correct answer is D, subdural slash stroke. Question 62. The window setting, window width 350 and window level 60 is best for visualizing which of the following? A, brain, B, CTA vessels, C, soft tissue abdomen, D, subdural stroke. All right, the correct answer is C, soft tissue abdomen. Question 63. What happens when window width is increased? A, contrast decreases, B, contrast increases, C, no change in contrast, D, none of the above. All right, the correct answer is A, contrast decreases. Question 64. The common carotid artery bifurcates at approximately which level? A, C1, B, C1 to C2, C, C2 to C3, D, C3 to C4. All right, the correct answer is D, C3 to C4. Question 65. The common carotid artery bifurcation can be found at approximately which level? A, atlas, B, dens, C, mandible, D, thyroid cartilage. All right, the correct answer is D, thyroid cartilage. Question 66. Where does the left common carotid artery arise from? A, aortic arch, B, right brachiocephalic artery, C, superior vena cava, D, thyroid cartilage. All right, the correct answer is A, aortic arch. Question 67. Where does the right common carotid artery arise from? A, aortic arch, B, left brachiocephalic artery, C, right brachiocephalic artery, D, thyroid cartilage. All right, the correct answer is C, right brachiocephalic artery. Question 68, almost there. The celiac trunk divides into three branches except for A, common hepatic arteries, B, left gastric arteries, C, right gastric arteries, D, splenic arteries. All right, the correct answer is C, right gastric arteries. So the celiac artery branches into the left gastric artery, common hepatic artery, and splenic arteries. Question 69. Which anatomy structure is the arrow pointing to? A, ethmoid sinus, B, frontal sinus, C, maxillary sinus, D, sphenoid sinus. All right, the correct answer is D, sphenoid sinus. Question 70. Which anatomy structure is the arrow pointing to? A, frontal horn of lateral ventricle, B, fourth ventricle, C, occipital horn of lateral ventricle, D, third ventricle. All right, the correct answer is A, frontal horn of lateral ventricle. Question 71. A filter beam that is more homogeneous is less susceptible to which kind of artifact? A, beam hardening, B, metal artifact, C, motion artifact, D, ring artifact. All right, the correct answer is A, beam hardening. Question 72. The system's ability to resolve as separate forms small objects that are very close together is called A, contrast resolution, B, noise, C, spatial resolution, D, temporal resolution. All right, the correct answer is C, spatial resolution. Question 73. The modulation transfer function is a mathematical formula that measures A, focal spot size, B, the ratio of accuracy of the image compared to the actual object scan, indicating its imaging fidelity. C, the system's ability to resolve as separate forms small objects that are very close together. D, the z-axis segmentation known as the voxel dimension. All right, the correct answer is B, the ratio of accuracy of the image compared to the actual object scanned, indicating its imaging fidelity. I know that was a long one. Question 74. Higher peak kilovoltage settings produce A, X-ray beams with greater penetrating power, B, X-ray beams with lesser penetrating power, C, X-ray beams with greater milliampere seconds, D, none of the above. All right, the correct answer is A, X-ray beams with greater penetrating power. Question 75. Which artifact can cause inconsistencies of the projected data on the reconstructed image due to high density? A, edge gradient artifact, B, metallic artifacts, C, motion artifact, D, out of field artifact. Right, the correct answer is B, metallic artifacts. Some examples of metallic artifacts: your zippers, your dental fillings, braces, your hip surgery, knee surgery, jewelry that the patient forgot to remove or you forgot to tell the patient to remove. All of these are examples of metallic artifacts. All right, so that's it for this video. I know it's a little bit shorter than my other video. I have 2 or 3 100-question video. These are some people that passed their registry. They found my videos helpful. I do have more that have passed, but I couldn't find their comment. But anyway, thank you all so much for watching. Oh, shout out to um, obviously Denise for sending me a donation after they passed their registry. But thank you all so much for watching. Oh, someone else sent me a donation. I can't think of her name because I can't find her comment. But if you found this video helpful, please hit the like button for me, hit the subscribe button so that I can make more videos. Also, shout out to all of these people who passed their registry exam. Click on the playlist that's going to be right here to get to all of my CT videos because I do have videos for X-ray, mammo, MRI. So clicking on this playlist is the easiest way to find all of my videos for CT. You can just go through and binge watch them all. And also feel free to leave a comment if you found this video helpful. Good luck on your registry exam and thank you all so much for watching. Bye.